palliative care is becoming more known, a lot more in your hospital setting. They have the palliative care team, and I feel like there's so much still growth room to go on the home side of things. We have a lot of referrals now for palliative care. Even in the 2.5 years I've been with Mountain Valley, I have seen how influx those numbers are. I mean, now we get a wait list. It used to be, we get to you in a week or two. Some patients might be 2 months before we can get to you. But just getting the word out there to a lot of your family practices, I still feel they don't fully understand the role of palliative care. And a lot of the times we get referrals in palliative care, but it's when we really should be hospice. The more we can get what palliative care does, meeting those patients upstream in their chronic disease processes, I think can go a long way in their journey with how the disease progresses. There's only providers right now, but I feel like in the years to come that home component that palliative offers to help manage these chronic diseases can really grow, especially if we can expand with nursing. That can also help in that side of things, just because these patients are sick. A lot of them have multiple comorbidities. Getting to appointments are an issue. So knowing that palliative care can offer that in-home support to help manage these diseases, that a lot of them, there's not surgical, it's all medicinal management. So just guiding them in their journey and then saying, hey, it's time to transition to hospice. I see a lot of the times these palliative care patients, they have, I guess, like an old school view of hospice of, oh, I've got to wait till I'm like end of life. Like, absolutely not. Like, part of my job in palliative care is to help you understand what's out there to help you. And a lot of the times I see that patients that we get upstream in palliative care will actually have better symptom management and quality of life and than they would have had otherwise, just because we also have the time to sit. I'm not pushed to a 10-15 minute office visit to where I'm coming in, what's your symptoms, let's go. No, I sit there and we have in detail goals of care, discussion, what do you want for your life? And code status, it's a big thing that we talk about. This is what CPR looks like. This is what intubation looks like. This is where you are in your disease process, but it also gives that, 30 minute to an hour time block to where I can really dig in on what is your understanding. And then let's walk this journey together. And then I feel like we do have patients after we have that conversation in palliative care, if it's time for hospice, once they understand how beneficial hospice can be and all of those resources, a lot of patients and families are more up to transitioning between the programs. But I feel like they work together so aligned, palliative to hospice. You really got to have both.